Hi, good afternoon everyone. My name is Claudia Maldonado. Today I'm gonna be talking about the lower gastrointestinal system. I'm gonna focus on the barium enema procedures. To begin, this type of exam is done to evaluate any abnormality on the lower gastrointestinal system. That means the large intestines. To begin, the technical factors that we're going to be using is the same as upper GI. That will be for a post-evac, it's going to be from 80 to 90 kbp. If we're going to use single contrast, it's going to be 100 to 125. And if we're going to use double contrast, which is air and the barium enema, we're going to have to lower a little bit the kbp. So we will be fine if we use 100 to 110 kbp. It is important to have in mind the contraindications, which could be perforation, appendicitis, or any large bowel obstruction. If the patient has any of those, the exam cannot be continued. And another thing to have in mind is that nothing per oral has to be accomplished 8 hours of fastings. And then we also have to have in mind the indications. So these exams are diagnosed for people who have colitis, which is inflammation of the large intestine, ulcerative colitis, which is the cobblestone and stovepipe radiographic appearance. It's also done for diverticula, intussusception. In fact, it is corrected by intussusception, volvulus, neoplasms, among others. Okay, so for the positioning, I'm gonna be starting with my mom. She's gonna be helping me today. We're gonna do the PA examination to see that there are not abdominal contents and the bowels are clean and nothing can obscure the anatomy. So I'm gonna ask her to lay on the bed on PA position. There you go, mommy. I have to stay there. Get it, mommy. Okay, so I'm gonna have to make sure that she is gonna be aligned on my sagittal plane. She is completely straight. The center ray is gonna be the same. It's gonna be at the level of the iliac crest. I'm gonna use a 14 by 17 cassette, which it will be from here to here. And then the center ray is going to be here at the level of iliac crest. Okay, so that will be the first position. The other position that is done for the barium enema. Oh, okay, an important fact for the barium enema is that the enema bag cannot be above 24 inches. And the first position is the Sims position, just like she is. She's gonna be an LAO, just slightly. This leg goes a little bit open, and this one here, so we can do the barium enema, the tip insertion. This position allows to relax the abdominal muscles and also decrease or increase abdominal pressure. When they insert the barium enema tip, it has to be 1 inch to up to 1.5 inches toward the umbilical. Okay, so that is one position. The other one position is the other position we can do the LAO, which is gonna be the same. The rotation for both is gonna be the same. Either LAO or RAO needs a 35 to 45 obliquity. So the center ray, it's at iliac crest. All has the same central ray, and it's gonna be 1 inch lateral. So 1 inch will be here from my sagittal plane. So I will put my central ray over here. That is for the LAO. For the RAO, it's gonna be the opposite. Mami, gira para la misma forma para el otro lado, por favor. Ahí. Okay, thank you. Okay, so for the RAO is the same. I have to make sure that she's straight. So can you bring your body a little? There you go. Perfect. I need you straight with a 35 to 45 obliquity. That should be enough. Okay, elevate this a little bit more. There. Okay. Okay, there you go. The center ray is gonna be the same. iliac crest and 1 inch to the elevated side, so it will be around here. With the same cassette, we have to make sure that we get this match up to this match. The rectal ampulla has to be included on the x-ray. If we clip the left colic flexure, it's gonna be okay. Okay, so when we're on our RAO position, like this one, we're gonna be showing the right colic flexure and the descending column. When we do the other position, it's gonna be the left colic flexure and the descending column. Another position that it's done through these exams are the left lateral decubitus and the right lateral decubitus. That is to see air levels. So if we do the left, since she's already in this position, I'm gonna do the right, in which she's gonna turn 90 degrees. There you go. If we can, now you can put one on top of the other one, like if you're praying like this. There you go, perfect. So you're straight. We have to make sure that she's completely aligned and the femoral heads are completely superimposed. So if she is on her right side, the air it's gonna go to the left, and then the center ray it's gonna be the same level of iliac crest, a 14 by 17 cassette, which it would include this amount of light. The exposure is done on expiration. If we do the left lateral decubitus, it will be the same center ray. It's just that the air is gonna go to the opposite side, which is the right side. And the last position is for the AP axial, which is to see the rectosigmoid column. This is a special view. So, ma'am, boca arriba, por favor. There you go. Thank you so much. So it's just gonna be like that. There you go. Perfect. Okay. If we're gonna see the rectosigmoid, what we're gonna do is we're gonna angle the tube. It's gonna be 30 to 40 cephalad. And then the central ray, it's gonna be at level of ACs. So I have here my iliac crest, and I can feel her ACs right over here. So we're gonna go 2 inches below ACs. 2 inches will be like 4 fingers. So I will put the central ray over here. And then I will use 11 by 12 cassette lengthwise like this. That is to see the rectosigmoid column. That is cephalad. If we're gonna do the PA projection, it's gonna be the same. Can you rotate the other way? Boca abajo, mamita, por favor. There you go. Thank you. Okay, so if we're gonna do this one for the rectosigmoid, there you go. We're gonna angle cauda, 30 to 40 cauda. And then the center ray is gonna exit just at the level of ACs. So here is her ACs. It's the same cassette, 11 by 14, and then the center ray it's gonna be over here. All right. Thank you so